Good morning. This is the African Actions Network radio and television station. We are here this morning, and I have with me African Actions Network radio and television station. I have with me Dr. Mark Fagbini, Fagbili, and he's going to be here for us while we discuss a very important topic this morning. And what is that topic? It has to do with Liberia Health System. And we'll ask the question: why should government of Liberia depend on government resources for health? Why citizens don't have the opportunity to, benefit from the healthcare system? So that's the question we are about to discuss this morning. Liberia Health System. So Dr. Fagbili is indeed in the health system, so he will better introduce himself in that regard, and then we continue with the discussion this morning. So, that welcome again.
Welcome, sir. Well, my name is Dr. Max Swapley. I'm a neurologist and originated from Nama, Bong County. As usual, I always say, in the beautiful village of Mowi, where I was born. And I serve in the healthcare system in Liberia as a laboratory technician. I graduated from the Tottenham National Institute before I came to this country, and I went to several uh, colleges and state university in California. Then I became a neurologist and practicing in California. But I also have interest in the presidential election coming 2023. Thank you.
Okay, that's the voice of that Fagbili. Indeed, he said he had interest in Liberia's presidency. But this morning, we're discussing the issue of health delivery system, particularly so our attention got drawn to what has happened with government officials, the past and present. Okay, there's an argument going on right now in Liberia about not argument, but discussion about the former vice president, Mr. Joseph N. Walker, or Ambassador Joseph N. Walker, Jamaica. So, Ambassador Walker, I understand he's not well, and that the government of Liberia has offered to ask him or the former as to what they can do to help him. Now, that drew us to ask the question: is there a health system in Liberia? If there is one, why don't government officials use the system to take treatment rather than a government official pass a present? When they get ill, the first thing is they try to go in the national coffers. What is there for them? We are asking this question because there are other countries, even around Liberia, that do have a system as to how they can provide health for their citizens. And as a citizen, mean whether you are a government official or you're a citizen, person that means you have access to the healthcare system. Now, in this case, Dr. Fagboli, let me ask you a question. Comparatively, your experience since you are working in the healthcare system and you've been going there in recent time, what is your own assessment about the healthcare system? Is there a system for healthcare delivery in Liberia?
The answer to that question will be no by me. Because when you talk about healthcare system, there are some things you articulate and put in places that make sense for the masses of the people. And the idea of Ambassador Joseph Newman Boaka getting sick, I mean, based on our age, yes, even the younger person gets sick. I don't have no problem with that. And I sympathize with the family of Joseph Newman Boakai that he get well and come back and take part in the election. So when I join, I can really defeat him for him to know that his days for Liberian politics are over. With that said, I gave which Ambassador Joseph Newman Boakai, former Vice President, a very speedy recovery. Now that we come to the healthcare system, this is not just this administration or the administration that followed before this. This is a systemic problem that has been created by Liberia since its beginning. Some of the problems fall as far as before even 1847. We have people who left from here have no knowledge of how to establish country to benefit the citizen. They only created a system that were working for them, but were not working for the rest of the country. They divided, segregated our country. They had the native which were living in the interior, and they had the American Liberian, those who left from here are ex-slave descent to go and establish government. So the system they put in place were not right. First, we have no facility of testing any drug before it enter Liberia. That's
Okay.
one of our problems. And the knowledge they put there from the beginning to destroy the system was anyone can walk to any pharmacy and buy anything they want. Those
Mm.
are all key areas where you destroy your own system. For
Okay.
example, when I say they destroy their own system, those two areas that I named, let me go back to it. We have a system in every country around the world. Before anyone can even take a pain tablet, they must see a advised medical practitioner, whether it's a physician assistant or a nurse or even a primary care doctor. You don't have to be a specialist. This is what they are for. But the system were not put in place to tell them, no, we can't sell you the drugs. The system they put in place, anyone can sell any drugs in Liberia, whether it is a narcotic drug or medical drugs.
Mm.
So that's wrong in the first place.
Mm.
Because there's nobody there to this. If pharmacy could be selling narcotic drug,
Right.
and there are restrictions on every drug depending on we look at the potency at one area where you want to look first, and
Mm.
also what are the ingredients to that drug and what are the impact on the patient. So you look at all those areas and before you can even order a drug for anyone. Then we have another aspect of that system where even those who are medical practitioners in the public hospital, like JFK, Town, or Phoebe, or Ganta, or any other hospital in Liberia. They have no restriction how to control those people to do something. When the international organization provide drugs to the various hospital, those drugs leave the hospital to the private clinic or private hospital or drugstore. And when you go to JFK or any other government hospital, the medical practitioner there will tell you, look, if you want to get well, you have to go to this place for the drug, for this drug. It's located on this street. Only then before you can get well. The fact is that the same drug that was taken from the hospital was sent directly there under their supervision and they are selling it to the public. But when the citizens get to a public area like JFK, they tell them, oh, we don't have the drug, but you have to go here to buy it. That's one aspect of it. And another aspect of it is this. The government officials that are involved, that have been involved, have never taken into a consideration because of lack of what I call uh, ignorant or lack of knowledge of medical system. They have never put a system in place. Because if I become president, the first thing I will improve is the hospital in Liberia. What if I'm sitting in the executive mansion, I get a stroke?
Right.
So how long it will take for them to put me into the car to go to Ralphie, then before they can fly me even out of that country to go to other medical facility? That's too long.
That's true.
When you have those kind of sickness, you need immediate intervention.
Right.
So they have killed themselves, including Joseph Human Boakai. If we had a facility well equipped, well set up with right people, with a right system, then they can take treatment immediately in Liberia.
Right. Right. Right.
So with his system, I really ask God to help him. I hope he will get well and come back so we all can rejoice. Because here is where I stand. I'm speaking now as a president because I know I will win. I am not against Joseph Human Boakai. I'm against the system they have put in place.
Right.
And part of that system. He cannot tell me he worked with Eric Joseph for over 12 years. He didn't do nothing because he will honor somebody. That's wrong. Let Joseph Human Boakai tell the people, you see, these are the system that I have been talking about. Now he's sick. What if here they don't have the medicine? How is he going to survive?
Right.
What if it was a stroke, cardiac stroke? How will he be helped? So these are complicated cases that have been manufactured by the political leaders in Liberia. We must understand that this is not about us. It has to be about our government and the
Right.
people.
Right.
And number four of that, look, it's a good topic. Give me so forgive me when I'm talking too long.
Yeah, that's why. I mean, I'm not in the health system. I don't
Number
have.
four,
Right. So,
the citizens of the country will never subscribe under the system that they put in place. Because if they were, there are some medical area ER that you can set up to help the citizen when something happens. They immediately go there and have some service before even they can do something. You and myself know that we live in America. You can go to any emergency, even if you don't have insurance. Based on your condition, they can give you certain service
mm,
until they ask for your insurance. And they never put any of those places together in a way that it can benefit the Liberian. You go to a maternity ward in Liberia, some people waiting until they deliver. And in realistically, sometimes going to the hospital in Liberia becomes useless. It have killed some people
that is true.
because
That
it
is
was
true.
just a waste time. It's just good when you know somebody in the medical field, maybe you call them if they can come quick and help you. But some people have died just on their way to the hospital. And all these things have not been corrected. Our political leaders don't see it. All they see is their personal intake of capital from the government. This is not right. It is wrong. But let's proceed with the interview. I don't want to keep talking. Let me give you
Right.
some.
No, honestly, I'm going to like the lot of the talking, right? And you are right. No one is reaching Ambassador Walker and evil, but we're discussing the system. And the fact that he being part of the system, it is expected that all of them would have created a necessary environment for health delivery. Now, a good system is one that organizes attend access to highest attainable standard of care to all its citizens, whether you are a government official, you are a market woman, you are a student, you are a wheelbarrow boy, you are they call it Zogo, whatever it is. When there are in the time of sickness, it is well expected that there will be a facility. Particularly so the way the country is divided into counties, like Ghana, I was looking at Ghana website, something on health in Ghana. Ghana is structured in such a way that even as of now, they are building health care delivery. I mean, system for health care delivery. So for Liberia, I mean, we are talking because we all have relatives and friends in that country. Let me say, for example, that I was involved in an accident in America here. Coming from work that early morning, somebody bounced into my car. Very serious accident. But the system was there, and I never had a relative with me, but the system provided to someone as a caring person just make a call in that moment. There were ambulances, there were helicopters flying around, there were everything that was needed to help me survive. How I got to the hospital, it was the system that got me to the hospital. I'm living today because of that. So when you see some of those things and you look back from where you come, you want the system to be better. And that's why we're discussing some of these things. People who don't understand, say, oh, because your Boca is saying that why people say, no, that's not the issue. The issue is Ambassador Boca has been part of the system. For example, they have the National Social Security Corporation in Liberia. What system? That corporation is only used for people to withdraw money. But instead of they all focusing on building a system so that even, I mean, a former government official should have his insurance they should benefit from. Or there must be some profit. Whatever system they would have created for them to benefit from it. And then the citizens themselves would have a means of providing insurance for citizens. When you have a whole country and there's no system, now that brings me to a question. Um, what make in your own view, what makes a good health system? What can we tell those who are in the system to know that this is a good system for health delivery?
A good health system is not only because you have a good doctors, you have a good building, but it's entirely from the ground or from the cook that cook in the kitchen in a
Okay.
hospital. They have to cook specific diet to
Right.
suit specific patient. That's how hospitals should be articulated from the ground up. Okay, those are the things. But the real system that missing is talking about is this. Nothing was ever put in place to benefit the Liberian people in general. And nobody have ever said, let's revisit what we have and see how we can make the correction. We need a healthcare system that have a backing of an insurance because it's oh I don't care. Look, right here in America, I work in a private hospital. When you come to that hospital on any condition, the first question will be asking, do you have an insurance?
Right.
Even if you cannot talk, your family will be asked that question because that is a guarantor of your treatment.
Mm.
Even if we are to help you because of your condition, there where we start from. We ask for that document or that information so that there can be chance for the hospital to make at least not all the money, but at least a little bit. But in private hospital, they lay serious emphasis on insurance.
Mm.
We have two parts of that insurance cases. Our people have never been educated enough for insurance. Look, when you and I were coming up, we were young. I didn't know anything about insurance.
Right.
I came to this country before I began to understand insurance, even the insurance I put on my car. I never put Liberia Coalition. All my cars have full coverage. The
Okay.
reason being that it's very expensive to pay. I'm with triple A.
Okay.
Okay. It's expensive to pay, but the time you don't expect accident at the time it come.
Right.
And the deductible is 1,000. They can either condemn that car and pay me for the value or they can fix it.
Mm.
If it even 20, 30,000, 50,000, or compensate somebody that was in that car with me, it's not my family or my family alive, they will do it according to our agreement.
Okay.
So what I'm saying here is that everybody don't have to pay expensive insurance. We should have started a medical insurance system in Liberia in a way is reasonable
Mm.
based on our economy so everybody can be able to pay. When they pay in a pool, large number of people come, it become a big money.
Mm.
Then they will be able to help those who need help. But none of the, even the government official or any of them have never suggested that on the table to just make practical sense. They have never provided education to our people for those kind of even system. Look,
So
we are not creating anything. The system is there. We need to practice and go. But let me go a little bit different. Let me so you can before you ask your second question. Let me go a little bit different. Why a simple thing like address system in our country is the problem? After 170 some more years. Why? We cannot really identify place and say we go. For you, Mr. If I were in Nama, I get sick, I call you. Pretend that you are a doctor. And probably it will Phoebe when we are lucky, but you will be in Monrovia. Even if you have a helicopter to come and pick me up, how will you pick me up without proper address? How will you identify me in a system without proper social security number for the citizen? There are so many factories. There are so many Flomo, there are so many Kekla in Bon County. So there should be a system where we can identify people properly. As, even if we, like I told them before when I went there, we have a system that is broken because our computer system, we're not investing into it. That's why every time life go, they want to go all the things that we're dealing with. It's not supposed to be, but we are not investing into it. Let's create a tongue drive system where we can put patient record there. They hang it on their nail, we download it. When they come, we put it in the computer, download it. We know their condition before we can treat them. But in Liberia, it's not. The patient come, they don't do any test. Any test. I mean, telling you, any test. But immediately they start implementing drip. What you don't know whether the drip is a sodium, and if the person have pressure, that's a problem. You don't know whether the person is diabetic, they give them glucose. You are killing them. You're not even giving them anything. You pushing their death further because they already have the thing in their system. You're adding to it. They don't know when to give uh, uh, glucose or distilled water as a drip. We must set a system until somebody put up a simple thing like a dribble, whatever medication you want to put inside. First, let's make sure it's identifiable to the patient need. But let me let you ask some questions. This is my area. Now I'm talking in detail. I'm sorry.
I agree. I know that's your area. That's your area, and so I'm not surprised the way you're talking because that's we want those who are listening to get the message, so that even if government, and this is where I'm now thinking, do our people pay attention to so many talk shows, so many concerns being expressed? Because it makes a lot of sense that people begin to think beyond themselves. People become selfless and begin to look at these issues very seriously. Now, the question I wanted to ask you was, is it possible to build a good health system in Liberia?
Yes, sir.
How do we build one?
Well, we need to. I don't want to use the word colonize in every aspect in Liberia. The American colonization came. They said they came to colonize our country, but we were never colonized. If you go to talk about rebuilding something like this, you have to actually know what you have and start creating ideally how you want it to be. And we have to consult other countries, really know most of the detail, how did they started and how far they have gone. And we take the good one and apply it to our country and we invest into it. If I become president, like I said, sir, the problem I have with Liberia, there is no consequence for anything. In this great United States, every 6 months, we go by to class and defend our education. If you say you are a medical doctor in this country, it's not forever. You are tested after every month to see the new equipment that have been made if you have knowledge of it, or the new drug that have been made, you have access to it before you can even give it, recommend it to people. That's why that test is for evaluation.
Okay.
But how many of those people in Liberia that came from medical school have never read one other page, have never been tested? They are all practicing, including nurses.
Mm.
And this is the country where nurses begin to take over a medical doctor work. They are not even primary care doctor or physician, but
Yeah,
they all,
everybody in Liberia, as long you are a nurse, they call you
it
doctor.
is completely a need to be dismantled and restructured. And it will require a lot of education and a lot of discipline. You introduce a system, you give them the opportunity to be trained. They go to a room where they will talk to them, and for maybe 2 or 3 weeks, and those who will violate it become your first victim.
Mm.
If I
So,
get to Liberia now,
mm,
I will start with pharmacologists. If you want to own pharmacy, you must have a knowledge in the area of pharmacology. And I'm not telling you go back to college and do, but you have to go to 6 month school and get a certificate through us before you can open your pharmacy.
that would be a long time to provide that kind of a system that you'll be dreaming about.
I mean, you will be learning after that, but just to start, you will need you in the classroom for 6 months. And whether you will pay for it is up to you. That's your business. You must decide what you want to do. And if you don't do it, after the first training come up, we start closing illegal pharmacy around the country, not just Monrovia. Everybody
There
can
is,
get up and
there
open pharmacy.
is, there
That becomes
is, there
destructive
is.
people because they are issuing drugs to people. They
Mm,
have no idea of the side effect.
okay.
Even though some of these drugs are good drugs, but it end up killing you. Even if you overdose, they cannot control it.
Right. Right. So, the government of Liberia recently, there's a clinic that we have read about in Rappel County, and they call it the Emirate Hospital. And I was looking at structure, and like you said, it's not just a structure. We are wondering whether they will have best professionals and have medical, you know, equipment, best medical equipment and drugs for that area. The same thing happened on the early administration. There was a very good medical hospital that was built in Nima County. And that too is like it's not really providing like needed services for the people in that part of Liberia. Now, when we see these things, that's why, like you said, before you build a system, you must have done feasibility study of how can you get involved in those things, so that you can't just do maybe like for example, somebody say we have 14 military hospital being built by George Weah. Then we ask the question: is that providing the needed services to the people? How is it being done? So these are some of the, and now don't blame us when we are discussing this thing, because if you do what you're supposed to do, the impact will be felt. If citizens, when there's no citizen can act easily in Nigeria, whether they are certified with the health system, they will say yes. Now that I'm not talking about your intent for the presidency. For how can people like you, I know there are many other Liberians who are in the medical field, can really see Liberia and get in there to help. Because it's a matter of concern. I mean, it's not about just those who are there. For example, you could leave from here and go to Liberia while you are campaigning, something happened to you. Now, to take you from there and bring you back where you will enjoy all your health insurance and everything, it might just be late. It might just be late. So how can most of you in the health system be thinking about? I know sometimes that people make a proposal, the government don't want to look at it. Like you said, there was the time you make some suggestion and people didn't look at it. People wanted their cut instead of wanting things to happen. How can you people get to help the system to help the country?
Well, the Liberal government can be built, but there are two things that are obstacle to it: the people themselves and the official as well. Well, you said when you ask an average Liberian, they will say, "Yeah, we get a better hospital care system." Look, in most cases, when I talk, people don't want even to listen to me on the ground until I really talk a little bit more and explain in detail to them.
Mm.
The population of Liberia have never had a health system that can help them, so they don't know better
Right.
when it comes to healthcare system. They will tell you, "Oh yeah, we are doing this." They are doing that, some of them, because of the pride they have in them for that country. That we are saying our country don't have medical system, while our neighbor have medical system. But I can remember when I was coming out in I think 8 or 9 grade, people used to come from Ghana and come to Liberia for health.
Right.
But
Right.
the degraded, we did not add on, continue to add on to what we had.
I see.
And we have not been able to define most of the things that suit for modern day life. For example, our airport, that place you have been now, 5 or 6 or even 10 major airports in Liberia where 5 or 10 planes can land at the same time and 5 or 10 planes take off based on the money we have been receiving for development.
Right.
Look, for example, I can come from here and I say I'm going to Kipama. I could have looked for a flight that would take me from Monrovia to Kipama, or have a joint flight to go there. But we don't
Right.
have those facilities. Same as the health.
Right.
If you go in the county, even the hospitals are there that belong to the government, they are all in deplorable condition. The few hospitals that survive in the interior that look little better, even though they are degrading now, like Phoebe,
Mm.
Ganta Hospital, and Zvedru, and other county hospital. Even when you go to Lofa, they have little. Most of them are private. And in the old days, the reason they were run by the Lutheran or other churches,
Okay.
almost like an NGO, be their own medical facility. That's how Corridor ended up being a university college in Liberia through the Lutheran.
Okay.
So what we have, what I have in my group here is we want to decentralize the government. And when you decentralize government, we will have facilities just as other people have been around the country. But not just the facility, also we will pay attention to. We will spend on equipment and technicians.
Right.
People who we don't do we don't have a neurologist in Liberia, we don't have an orthopedic, we don't have even an ENT doctor anymore.
Mm.
All we have people who graduate from Dogati Medical College as a primary care doctor, but they're doing everything, no restriction.
Right.
And the nurses that graduate from either TNIMA, Phoebe, Zoto, some institute in Zoto, all
Mm.
those things there, guess what?
Right.
They are the one now as a local doctor in the interior. It's not supposed to be like that. I once came in contact with a nurse that graduated from Cotton, and she was treating one of my old teacher. You know, this lady, trust me, she's very beautiful. She's old now, but she's still beautiful.
Mm.
So she have heard that I was in Banga, and she called me. She said, "Oh, I have this problem. I have not been able to solve it for a long time, but this girl can help me. Every time I have it, she come here and give me some medicine to go down." She was giving the woman penicillin.
Mm.
But here is where actually they like that was the wrong medicine for that sickness.
Mm.
That's why when you give the penicillin, it go down a little bit, and then after 3 4 months, it come back again because that was not the prescribed treatment for that.
Okay.
You needed to use one drug that was in Liberia during the old day called gentamicin.
Okay.
There's a difference between penicillin and that drug, and those drugs are specific for specific function.
Right.
When you go to the medical field, you know. But if you give penicillin, it's just a substitute drug. But the thing that really got my attention, I couldn't believe it. This girl loaded 10 cc, 10 cc of penicillin and want to inject it into the lady in a person. The
mm,
maximum of penicillin you can give to one person is 4 cc.
mm,
Depending on their weight, you can
mm,
start with 3 cc. I'm talking 10 cc.
right,
And I said, what medical school do you go? Oh, I graduated from college. I said, did you ever listen to your instructor when it comes to penicillin? This drug has been one of the oldest drugs to give in the world, but it's one of the serious killer. The way
right,
you're giving it, I wouldn't even want to prescribe penicillin today
mm.
because
But
penicillin sometimes can
they,
work. It can work, but it can kill you instantly.
right. The thing you're talking, I mean, it make me to even start to think. Who are the medical professionals? Do you have? I mean, if you think about Liberia, you wonder how that country is going to really get on its feet with some seriousness. Because no matter how we talk these things, some people are becoming immune from so many discussions that we're having. People are pointing out these problems. Whether, for example, the health authority will begin to look at these matters, you know, is becoming a problem. Do you have um, professionals who are taught to teach, medical schools? Or do you have someone who, like maybe I go to the librarian and say, okay, I can read and write, and so I can go and pick up chalk, and begin to teach nursing students. What would I be providing for them? These are concerning because, you know, most of the professions, they should be by way of, like I said, evaluation, because some people are the system, some people remain in the system, train other new people to come. I mean, they take over the system in those kinds of ways. But I don't think it's happening. Now, even Liberia, with the kind of economic condition, people may not even want to go to school. So the great problem is becoming complex. So my concern now is the healthcare system, like you have, I'm going to emphasize the national social security, where they're supposed to have old people what to do for them, even government officials or not, you know. So it comes to the point where we ask the question, government officials, when they're old, they still want to get benefit from the government. And you know very well you did not build a system. How can we people, if you don't engage those who are in the system, they're going to keep doing what they're doing. And that is the fear that we all have. And this thing we're talking about is not only for Liberia, it's for even foreigners who are in that country. Somebody could come from a good system from America, from India, from China, or wherever they may come from, and live in Liberia for a while, or visiting Liberia, and will get involved in an accident. Will get involved in some, maybe it's some food person, could be involved in something, malaria, or whatever. And then because of the system, they could die. We have found Liberian living from here, going to Liberia, and in sudden, this person dies. People are marveling. People worry about what killed this person. I think these are some of the problems. What do you think?
Well, to start is going to be very tough. But I believe, based on where we are today, we can do it. Let me
Mm,
tell you how. That's the how you're looking for now.
right.
We have the LMA, Liberia Medical Association,
Mm-hmm.
of even Liberian that left Liberia that are medical doctors. We will vigorously first reach to them and
Right.
ask them to make sacrifice. They
Right.
are practicing medicine here. I
Right.
can tell you, I don't want to name people, but let me name one or two of my friends, Dr. Zumo in Maryland, and you have Dr. gov't in California, working with Kaiser as one of the renowned medical doctor. It's
Yeah.
just a primary care doctor.
Mm,
So these people, and many other, we have
mm,
nurses here that
right.
practicing in the hospital here.
Yeah.
They are willing to go home and make sacrifice for our country, but
Mm-hmm.
they have never found a government that is willing to create system to make them relevant so that when they come and teach people on the ground that they will follow.
Mm-hmm.
One of the obstacles in Liberia is Liberians do not like to follow any instruction. We know so much, we don't want to learn.
Right. Right.
If you and myself were having conversation privately, by the time I put a topic outside, you will know more than me. You will not listen to me.
Mm-hmm.
But
Mm-hmm.
usually, I meet people, I sit by and listen to them, let them really give me the detail of what they know. I understand it before I start talking.
Mm-hmm.
We have people that can help to do some of these things. But the idea, just because you left Liberia, you are in a system that have little idea, you think you know everything, that's one of our killer.
Right.
When they are going to Liberia for 2 weeks, 3 weeks before they come back, oh man, they are the best.
Right.
But when they come back here, the places they work, they ask you, you want to see them there, you will say, wow, that's the kind of job they are doing.
Right.
And I don't want to condemn them. At least they're working and providing their food and other things for their family.
Mm-hmm.
But we must be honest with ourselves.
Mm-hmm.
Certain area is not my area. For example, Barney had a program on your network here where he said there will be area when we get together and do business to fix airplane in Liberia.
Mm-hmm.
And some people have called me. They say, "Oh, this man you were talking about the last time on your program. Now he said he can fix everything here." They have not asked Barney. I told them simply, I am not an aircraft mechanic. The only thing I know about airplane, they say sit down here, I sit down there and fly from one point to another. That's all I know.
Right.
I'm not intending to go back to aviation to say I want to practice it. That's not
Right.
my field.
Right. Right.
Tell me about the human body, then I will put my hand there and dance inside.
Okay.
But when it comes to aircraft, I want you to ask Banning to defend that. That's
Right.
his area. That's why
Right.
he think he know. Let him
Right.
explain to us. If he convince us, then we go along with it.
Okay.
And why people think it's impossible to fix aircraft to our place. This modern day is a different situation.
In fact, I mean, I
He
also
can,
I
he can,
had
he can go on YouTube and buy all the parts of car. If the engine, the this, the that, with all the thing on there, he can just hook it together. The car start moving.
that's true. That's true. I mean, people like you said, people are really Liberians that jump into discussions and
But
say,
let me
"Oh,
go back to the medical
yeah,
because
that's the medical we are on," and because time
those
comes fast spent.
those area will have to do lot of training, lot of education, even to the public. We'll have to introduce an insurance system at a low cost. We have to decide how much it will be. Maybe 50 Liberian dollars just to start with. you know. Then we encourage business people who have interest and say, look, in the future, as we continue to create jobs in this facility and other facilities, then people will be working, they can pay you this amount, but for now, let's start with it. We have to beg people. Then another aspect where I have, an advantage where I have worked here for almost 10, 15 years, okay? There are retired medical people that are in this country. It will do business correctly and provide the right setting for them to come and help us. If we appeal to them, they will come and help us to rebuild, to retrain, to reteach, to re-educate our people to make it. But we cannot do that under the condition where there is no security in the country. We cannot do that. They will not do it. Their life, these people have worked in the medical field. Some of them have retired. They just want to live their normal life and do volunteer thing for somebody. Even in that 6 months, they can come and teach to our Douglas University, Cottington University.
Right.
They
Right.
will be able to educate our people to go gradually, gradually. And I who's sitting down here cannot guarantee to you that I will be able to fix all the medical problem. But it is better to start now we start fixing it in 10, 15 years from now, then we'll have a good system that we all can rely on.
Okay. I think probably some of you people are really needed in my country, and like you said, are some of you who have interest in the country to begin to write proposals or projects that whether you be president or not, that the government for the day will begin to look at some of these things. I agree that people always come up with their own plans, and again, when you start discussing these things about project, other people get involved, they think that they know better, and condemnation coming about. These are all some of the backlashes of some of the reasons why we don't have some of these medical and good facilities in the country. But Liberia being what it is, um, we all have to still keep pushing and get that country people thinking better. That country system must be better for everybody. Even if just leave from here and go to Liberia, if I get sick, I'm going to go to the hospital. I'm not going to be waiting to come back to America before I take treatment. I will need to take treatment out of it. Or even if I say, let me go to Ghana, there's going to be time. So it's better to have, like Simon Tour, the foreign minister, had an accident on the road. No one expected him. Nobody, I know he, I'm not sure he expected an accident. We don't know his condition. Government is not saying anything about what has happened to him or his no update. But information we got, even Phoebe could not help his system, could not help his condition. So they had to fly out of Phoebe, not flying out of Phoebe. They got him to Monrovia, and then flew him out of Monrovia to the country well known by government. All right. So these are the issues that we're talking about. If an ordinary person, let's say for example, Jason left and go to Phoebe or your way by something happens, who cares? It's not just moving a family or friends or other things that are going to happen. Probably I may just die. And that's why we're talking these things. And not because of somebody hating George Floyd, but people like you must overthink. Some of you must put other medical Liberians who are medical professionals to begin to think in the direction. Even if it is now public, it can be a private venture. They can get to Liberia to do a lot more for my country. Because as we see it, who knows? We are still winning election. If we are winning election, the system be still it is. In fact, in my opinion, people will be even more careless than even now. People will feel like, okay, I have no more obligation. I don't need Liberia anymore. So this is my last term, and a lot may happen. Again, that would be another 6 years of it adding to the people's problem. So I think some of you who are medical people should think about those things and be able to see how you can get involved into some of the private ventures so that you can either see maybe few of you can build the best hospital in Liberia,
Well,
through some partnership and what have you.
well, let me just come in shortly on that. I
Johnson.
decided to make a sacrifice when I joined Bwaka before running.
Mhm.
The hope was, or the arrangement between Henry Jala and other sedition was, and other Bwaka was, when they become legal in Liberia as a government official, we win the election.
Mhm.
I was going to take care of the health ministry, and I was really focused that we were going to do that. Little did I know that the campaign system put in place with Bwaga was a complete failure. He had this guy who was the campaign manager, Gafuan, who
Mhm.
only sat down in Monrovia. He did not even visit Kakata,
Mhm.
but they were hoping to win the country. As a campaign manager, I told them, first they promised me that campaign manager job. Then the second thing they say, I was not part of the United Party. So
Mhm.
they did not give it to me. You see, the thing about Liberia is this: we may sit down here and critique it. That's why people don't understand why the man is leaving his position to become president. That's the reason why. The way Liberian government officials look at you and myself, who come from America, or even the local citizen, we are complete enemy to them.
I think so.
We
I
are
don't think
complete
that's a kid.
enemy to them. And once they say you are their enemy, You are not part of their political structure. They treat you like enemy. That's why I try to avoid the terminology enemy. The way we understand it in Liberia is different from any part of the world.
mm,
We are rivalry. That's why I use rivalry. Now you see my point.
mm,
Because we all saying the same thing, but the implementation and the application of what we are saying is the one that's suffering our country. I don't refer to any of the politician as an enemy. They are my rivalry. We must fight together. And if they have the knowledge that I have, if they have the courage that I have, guess what will happen?
mm.
Regardless of who win, they could have come and say, you know what, this guy have some idea. Let's try him. That's the encouraging point to start. But once they label you as enemy, my brother, nothing you can do to protect that. They will not do anything good for you. They
Lastly,
will not-
time is fast spent at really, I know you gotta go to work. The last aspect of our concern this morning, and we said it, but I want you to see whether you can lay some emphasis on that. Is it good for government officials, past and present, to depend on government resources for medical treatment, and not citizens of Liberia?
well, to tell you the truth, government officials always have some privileges. Okay,
Mm-hmm.
even the great United States, the London, and wherever.
Mm-hmm.
Every system will be like that. This is the system we have to deal with. Even traditionally, we had township that had more power than the people that living in the. They have more privileges than the people that living in their villages.
Right.
But there must be some kind of room created for the local people to go to hospital and be treated as patients and get killed and come back. But that system have never been built. And there where I'm frustrated. If we can spend 30 to 40,000 on one person to go to hospital,
Right.
why don't we invest that money into our country on equipment, drugs, and establish something or screen drugs that enter the country so it can be usable for everybody? These
Okay.
systems are there. You cannot look at your finger. If you put on your hand, all
Mm-hmm.
your finger are not of the same height.
Right.
There's a reason why God made it like that. And that's the kind of system man have put into place. But the condition in our country is worse. That's the thing we should try to correct is worse.
Okay.
Let's try to reach to the people who cannot afford it. Let's
Yeah.
design a new program that will reach to the people. Because let's say you are my neighbor, you get tuberculosis and catch all your children. My children will not go free because they play together. They will get tuberculosis. They will bring it with the biggest house I have, the biggest thing I get. That disease will enter my street. They become vector of the disease.
Right. Right. And I think this is where we are concerned about the ordinary people.
So if those people that have been in power have that kind of knowledge, then they will try to curtail something to take simple disease away from us and including themselves. Like I said before, there are some sickness when it grab you, you have no way of surviving in less than 30 minutes or an hour, depending on how severe it is. More people are dying from pressure in Liberia because they do not have the right medicine available to them.
That's right. That's right.
They are having stroke because of these diseases, cardiac unrest because of these diseases. They do not even have the right food to eat to give them strength.
Mm. Okay, I think we will keep discussing these matters. For me, I think there are several sectors of the Liberian society that we have to keep looking at. And thank you so much for answering our call most of the time. So I want to give you about 2 minutes so you can give your closing comment. I know this can be a one-day discussion. Your recommendation, for the problem, even though you are not in government right now, you want to be in government, but what could be your recommendation that people could start doing now with the health system, until it gets to be fixed? What they need to do now in your closing comment, we wanted to address that. And also, I wanted to give a little bit of maybe a summary of your profession. Biology, is that, are you dealing with what? Viruses or what? What is it?
Zoologist.
Okay. So what is that? What is that? And then you get give us some more.
It's the science of the entire circulatory system.
That's still big for us.
We start with the heart and we start with the brain.
Okay.
Those are the two important parts that fall on a neurological treatment.
Okay.
Depending on the position of the brain, when somebody slap you real high, your brain shake.
Okay.
You get some kind of sound in your ear, woo, before
Right.
you stop. Those are all areas of the brain that have been shaking from the way it was sitting. If the
Okay.
brain is not sitting right, certain things go wrong, and it affect your thinking, your mental. Because even if you put your hand in fire, before you think that that fire is hot or
Mm-hmm.
anything that is hot, it is your brain that message is taken from your fingertips directly to your brain and interpret that fire is hot before you feel the heat. Otherwise, your hand could be melting before you if you have a default in that area. They call the lower upper cumbria.
Mm-hmm.
Okay,
Okay.
I just then in our circulatory system, if you take a medicine, if you think you just swallow that medicine, the medicine open your stomach. No, the medicine automatically open. It was made to open. Then the dilution take place in the stomach, and the kidney separate that medicine from the rest of the body and send it back into the circulatory system. Then it go all over. As it go, is treating the disease that causing the condition in the circulatory system, whether it's cholesterol or something, it melt it or something. And if it can't do it, we have to open you and find that particular vein. And the way we identify it easily without any equipment is the color. If you see a dark red vein
Mm-hmm.
in the artery, then that's the place we have a clot. We have to open it and let the blood go and restore it by move the one that the blood out from there, then we restore it. But it almost like we who eat palm oil. If you put your palm oil in the refrigerator, it
Mm-hmm.
becomes agglutinated.
Okay.
That's how it happens in the system. When the oil you eating, which is part of our diet, but when agglutination take place, that's the terminology we use.
Mm-hmm.
Then it stops the blood from floating, and those kind of disease can kill you instantly
Mm-hmm.
because the aorta and the vena cava they function together. They want pump, and the other one open and enter and pump it back to the blood system, and they want pump and put the pressure that go to the brain and come back down.
Hmm. We need to teach in Liberia. Anyway, the time is fast spent. I like to listen to professors. People
What
when you, the way you,
what I want to tell the Liberian people
mm,
or the people around the world that are listening,
mm,
I have a dream about Liberia. I was born there. I cannot deny that. My conscience that leading me to say I should be president is not because I want a job. I can hustle today and eat. If I go to Europe, as soon as I enter Europe with my passport, they scan it. Where they get the assistant set, I start receiving call. How long will I be here? Can I come to the hospital and do this? So for me to eat is nothing. Sometimes we go on a vacation and my wife get mad with me. When you home, if receiving call 24 hours, when you come to people other country, they all calling you. I said, it's just the way I have set myself. That's why. The profession I in, it go along with it. But I ask the Liberian people, even if you decide that I'm not the right person, for this job. I will not be mad with you, but I'm giving you a chance. I have the potential of changing Liberia to benefit most of the citizens, if not all,
Mm-hmm.
in the area of health, food production, infrastructure development, building real hospital, making it to work as a hospital so it can eliminate some of our death. And finally, let me appeal to the Liberian people. Let us try to continue with the hand washing system.
Okay.
It helps a lot. The food you put into your body go there because of your hand. If you
Mm-hmm.
don't clean your hand, the idea of more diseases entering your body is almost 85 to 90%. And be careful what you eat. Your life, the longevity of your life depends on your intake.
Right.
Be careful what you eat. It may
Okay.
not affect you when you are young, but when you get old, it will affect you. May
Okay.
God continue to bless the Liberian people.
Thank you so much. Thank you so much. As the voice of that of Willie, he's a presidential aspirant, and this morning we've been discussing Liberia Health System and why should past and present government officials depend on government resources and not the citizens. Now you heard from him. He's advising that the primary thing that you need to do as a Liberian, not just government official, is to always watch your hands. And I agree with him because we use our hands most often to touch things. So if you're taking anything in your system, you didn't wash your hand, you'll be taking those things that are attached to your hand into your body. That's words of wisdom to you this morning, and how we come to the close of today's program. This is the African Actions Network radio and television station. It's 2A radio. And until next time, well, I want to say have a pleasant and wonderful day. We're just beginning. Take it easy one day at a time. Now, if I believe, we want to say thank you so much for coming. And it's a pleasure to have you on our show this morning.
Thank you. I appreciate the radio and TV station as well. And I hope that we can do this again in the future.
Yeah, definitely, definitely. Okay.